I want to welcome all of you to this event. I'm Raj Kumar, the President and Editor-in-Chief of DevX. Welcome wherever you're joining us from whatever platform you're on, to this event, which is on the sidelines of Prescription for Progress, DevX's annual Global Health Summit that we host in partnership with a number of other groups in the Bay Area normally. And this year, all virtual, as we all know. And in fact, that's a lot of what we're here to talk about in a session that's titled Maternity Matters. It's really this shift to digital and to virtual that we've all made in so many ways in our own lives. And that is changing the way everything in the world works, including in healthcare. But before we really dig into what we're here to talk about today, let me just set the stage very briefly by saying why we're talking about maternity. It's sort of in the title, Maternity Matters. Why does it matter? I think if you care about equity in the world, if you care about justice, if you care about the Sustainable Development Goals, you very quickly start to narrow in on a specific problem in the world, which is that every single day, 800 women and around 15,000 children die, and they're dying from very easily preventable causes related to childbirth and pregnancy, related to diseases of young children that in theory are easy and inexpensive to treat and address. But in the realities of our world, people are often slipping through the cracks. They're not addressed by their healthcare system. And what would seem to be something that we can easily and directly and immediately solve turns out to be a really challenging problem, a wicked problem, you might say. And so organizations from around the world have been working hard at this. And in fact, at DevX, we and our colleagues at MSD for Mothers, or Merck for Mothers, as they're known in the US, have been partnered for a long time to try to focus in on this issue and say, how do we stitch together the ecosystem of players and actors to address this problem? And you may have seen some of the events we've done around major global convenings like the UN General Assembly, some of the reports we've issued, often focused on the funding gap, this $33 billion funding gap. And in theory, if you can fill that gap, you can address something like 24 to 35 million preventable deaths by 2030. It's a huge global challenge and opportunity. Well, something new has shifted in the landscape, and that's what we're here to talk about today. And it's this move to digital. It's this move to virtual. We're seeing it impacting health systems around the world, our daily lives in so many ways. And what we want to talk about today is, what is the opportunity around leveraging digital solutions to scale access to quality healthcare for these women and young children who need it? How do we do that? What is the opportunity? And so it's so fitting that we're doing this at DevX in partnership with MSD for Mothers, and in partnership with the Bay Area Global Health Alliance, which is an alliance of some 50 members, many of them in tech, many in NGOs and academia, but all in the Bay Area and in the spirit of connecting tech and global health. And so to get us going as we begin this conversation today, and it's going to be a rich one with fantastic speakers that I'll introduce in a moment, let me first just start by asking Sarah Anderson, who is leading the Bay Area Global Health Alliance, to give us some opening thoughts about how she sees this issue and where her alliance fits in. Hey, Sarah.
Yeah, good morning, and thanks so much, Raj. The Bay Area Global Health Alliance was launched at Prescription for Progress, and it's really great to be part of this event. We're most grateful to be here with our catalytic member, Merck for Mothers, MSD for Mothers. They've been with us from the very beginning. And now the Alliance is a Bay Area community with more than 50 members from across the sectors: academic institutions, NGOs, tech, biotech, pharma, and other private sector companies. We're also grateful to you, Raj, and the DevX team and our amazing speakers today. One of the things that we are exploring at the Alliance is, how can we engage the tech sector more fully to advance global health equity? And I really look forward to hearing from our panelists about how we might harness and expand digital solutions to really improve health outcomes for mothers and their babies. So thanks so much. We're so grateful to be here, and welcome to our audience. Back to you, Raj.
Thanks, Sarah. And I'll just say to everyone who's following us on whatever platform, use the hashtag Maternity Matters if you want to be part of this conversation as we go forward today. We'll be following along. And if you're here in the Zoom with us, you can put questions into the Q&A. We'll try to get them into the panel as we get there. But we're going to start with a video conversation that comes to us from the Bay Area Global Health Alliance. And it's between Bernardo Mariano Jr., who's the Chief Information Officer and Director of Digital Health and Innovation at the WHO, and Ben Plumley, who is with the Bay Area Global Health Alliance and is the founder of Oneoff Global. So let's listen to what they have to say in their conversation that'll hopefully get us started. And then we're going to dive into a panel conversation and hear from all of you who are joining us from around the world.
Bernardo, Mariano, thank you so much for joining me.
Thank you for having me here.
So to kick us off, I've got to ask, what has been your favorite app or technology that you have come to use yourself during the COVID pandemic?
Actually, the most used app that I have, it's not anything special, which is basically Outlook and a lot of WhatsApp. But the one that since the pandemic I started using is Audible for the audiobooks. And then that's one that actually it's an app that I started using due to the pandemic.
Do you know, I don't think you're alone there. I've discovered that I've been listening to books rather than reading them. So, how interesting. Well, look, WHO was on a digital journey before COVID, but how has the pandemic sped that journey up, both in terms of the internal management of the organization, but also in delivering the WHO health diplomacy agenda?
Actually, the pandemic, from the digital health perspective, accelerated our, first of all, program but also accelerated the need to respond. Let me just tell you three things that are happened since the pandemic. First, for the first time, we had an extensive engagement with the tech companies to design, implement, scale up digital solutions in WHO, but also to support countries. So that was the first, I would say, reaction. Second, we wanted to ensure that the very traditional WHO guidelines that takes years or even months to come, they had to come very quickly. So we had to accelerate guidelines because otherwise we would just become irrelevant, because actions, the whole pandemic was moving so fast that we needed to make sure that the pace we kept is aligned with the needs. Third, we wanted to ensure that sustainability of anything we do during the pandemic is there to make sure that post-pandemic, we also continue to enjoy, even to enhance some of the responses that we have. So, for instance, on modeling and preparedness and prediction, those are areas that we want to see them really influence the next pandemic in a way that we do way much better than today.
And how has that sped up digital journey impact other priorities of WHO? And I'm obviously thinking about delivering maternal and child health services in this crazy time. How has technology helped you advise countries more effectively?
Indeed, we initially, of course, during the early stage of the pandemic, pretty much the whole organization had to almost drop a lot of areas to focus on the pandemic. But as in a few months in it, we realized that other areas needed to also be basically serviced, and the antenatal care was one of them. For instance, we had planned to release, actually to digitalize the whole guideline, the process of antenatal care. So we accelerated that. So we actually, the first ever WHO smart guideline is for antenatal care, just to show that we prioritize that area. And of course, we also had to repurpose or re-engineer the partnerships to ensure that we deliver not only on responding to the pandemic, but also in addressing all other health areas, in more specifically antenatal care, considering the number of deaths that we have, the impact on young people, young women, and how this area requires that strong partnership to ensure that we deliver value and we see positive outcomes with all the privacy issues that we need to address to ensure that as digital solutions are introduced, they address the privacy concerns as well.
Well, we'll certainly come back to the questions of privacy in a moment. WHO has a number of priorities in maternal child health. And I wondered if you could talk about the connectivity between, say, this wonderful speeding up of rapid guidelines to, things that are already well established. And I'm thinking of particularly the connectivity with maternal and perinatal surveillance and response strategies. How have you been able to sort of link all of these together?
Together with a number of partners, we working in ensuring that the end-to-end processes that both on the digitalization but also on the response and assistance or on the interventions that we do on prenatal care or postnatal care is in such a way that all these benefits that we want to see that are connected to the targets that we have vis-a-vis how reduction of mortality, for instance, on that is so far is still very low. I think the last 3 years we've seen below 30% in terms of reduction of mortality on prenatal and antenatal care, but also the impact on low and middle income countries. So we are working strongly with our partners to make sure that we all bring what we are best at individually. So from our perspective, from WHO perspective, making sure that the standards, the guidelines, the governance is the best we can deliver. But from governments or from other partners and stakeholders, they have a better presence on the ground. They can have a better impact at the community level, and from governments they can prioritize this area accordingly. So partnership is a key element to succeed, and we understand that bringing this best of each into a common goal is what will make a difference.
You spoke about at the start the partnership that WHO has had with the technology sector, and that builds on the collaborations that you've had with philanthropic entities as well as pharmaceutical entities, and Merck for Mothers might be a good example of that. But how have those partnerships helped you in guiding, in speeding up the guidance to countries? And I'm particularly thinking about the concerns that many ministries of health have had about how COVID may or may not affect mums to be and mothers who've just given birth to their babies.
I think COVID-19 has shown to all of us that one area or impact of one area can create impact in multiple areas, meaning that if we don't address the antenatal care issues, if we don't address the pandemic impact on mothers and young people, or if we don't address all the risks that are associated or health risks that are associated with the pandemic, and the economic impact is high, social impact is high, political impact is high. So of course, working with the private sector in WHO, we use the whole framework of engagement with non-state actors to ensure that we address some of the key principles of those engagements. But the engagement with the private sector within that framework of non-engagement with non-state actors allowed us to advance in some key areas, to have support in key areas, including the antenatal care, that allowed us to enhance our response, but also enhance our preparedness. And I mean, the way like we engaged 27 companies in total. We created 47 work streams. I think it was all around $70 million of private sector engagement to support WHO, meaning that bringing the best out of each, understanding the conflict areas as well, because the private sector is profit making, we are public sector. So, but for this pandemic, I think we found that sweet spot that we could actually work together to deliver a better, good, and to deliver good health and well-being for all, especially during this pandemic.
One of the challenges that these kind of public-private partnerships have been dealing with is this, and you mentioned it, this question of protecting privacy and confidentiality. It's wonderful that these technological-based responses can help speed up the quality of care and also improve the guidance going to countries. But at the healthcare delivery level, the issue is going to be around how to protect the confidentiality of patients. That's true right across all aspects of healthcare. And I wondered, Bernardo, if you could talk a bit about WHO's strategy to address that and to reassure ultimately the consumers of healthcare.
At WHO, for issues such as privacy or even digital health, we try to work in three perspectives. One is what expertise is out there that can help us to address the issue. The second is how can we align over the organization at central level, regional level, and then at country level to ensure that whatever policy that we change, whatever guidance we bring forward, it impacts the individual at the family community level and not just having something that is a central level. And the third area which we are trying to develop now is really the feedback mechanism. How can, especially on digital technologies, how can we ensure that we have a mechanism that allow us to listen to the person that actually is being treated or is being is enjoying the advances that the particular technology is bringing to that particular health setting. So to ensure that those three areas work in tandem, we have from our ethics group perspective, we created an expert on ethics that are coming together to ensure that the guidance is solid. If I give you the example of a topic which is very relevant today, the digital vaccination certificate, it has the same issues in terms of privacy. And we have a group of 60 experts working with us to ensure that whatever comes out of this guidance, out of the framework, it comply with some of the key principles on privacy, but most important, to ensure that health data is not monetized, but also to ensure that health data is used for research because it's important. So it is a fine balance, but it's not something that we cannot do. I think, as I said, if we collaborate well, we bring the best out of each one of us, and we keep that good intention. The key principle of health of donate. We don't sell blood, we don't sell organs, we donate. If we keep those principles alive, I think together with private sector, we can do wonders. We can achieve the sustainable development goal targets for health.
And then finally, Bernardo, to bring us home, what do you think is the future? What's technology, and particularly, how is it going to impact the delivery of maternal child health services?
I think once I was in a conference, somebody said, "I wish that a mother, when during the prenatal stage, is able to actually enjoy those advances in digital to really monitor the whole process, but also ensuring that response is there." So one key element, of course, that is needed is the universal health coverage, right? High quality of health has to be there, both most important at primary health care. But with that, don't we need to advance those digital solutions that support prenatal, postnatal care, ensuring that the digital identity or the digital solutions that we have are responding to that. At WHO, we have what we call a digital solution clearinghouse to help countries to navigate through this myriad of options that are out there for digital solutions. So that is one area that we're working on to ensure that the countries can choose appropriate policy, appropriate tools that work in their local context.
Well, Bernardo, thank you so much for joining me, and good luck to you with all the work that WHO is doing.
Thank you. Thank you for having me. Thank you very much.
Well, my thanks to Bernardo and Ben for bringing that conversation here. And there are a lot of threads in there, I think, that we can pull on as we get into our panel conversation. I'd like to ask our panelists to go ahead and turn on their cameras and join me on this virtual stage so we can dive into the discussion. And again, those of you who are joining us on Zoom, go ahead and put your questions in the Q&A. We'll try to weave them in as we go. Let me just tell you who's here with us. You see it on the screen, but Njide Ndili, who is the Nigeria country director at the Farm Access Foundation, and a real leader on these issues in global health. It's so great to have you here, Njide. Natasha Sundarji, who is the global health lead at Accenture. Great to see you as well. And Dr. Nosa Orobatan, who's the senior advisor for health at the Bill and Melinda Gates Foundation's Africa office. Great to have all three of you here for what I think is a really important discussion. And maybe, Njide, I could just start with you, because I'd love to ground a little bit of what we were hearing from Bernardo and Ben in that last discussion. I know you work on an initiative called Mom Care, and you're looking at how can you use digital services to support a woman going through pregnancy, going through childbirth. Like, tell us how that is working and what are some of the lessons that might point to this bigger picture question we're asking today about the opportunities around digital to support maternity. Go ahead.
Thank you so much for having me. I was very excited listening to the conversation because there were two key words which stood out for me. First, of course, is digital, and two is UHC, in terms of how that it can be used to not just monitor the mom, but also to ensure sustainability in the end. So yes, we are implementing a program in Kenya and Nigeria. Interestingly, this has been scaled also in Tanzania in collaboration with MSD for Mothers. And basically, it is the use of the mobile phone to not only track the care that the moms are receiving, but also to nudge them so that there's kind of behavioral change, as well as incentivizing the providers to, incentivizing the care that is provided, such that in the end, there's quality of care almost, monitored and kind of guaranteed. So in a sense, what we're trying to do is even before the mom is pregnant, in Kenya, I'll use Kenya as an example, there's the mobile wallet, which is MTBA. For those who don't know, this is the mobile wallet layered onto M-Pesa. Kenya has one of the highest, mobile money transactions. In fact, about a fair percentage, almost, if I'm not wrong, about 30% or more of the GDP is actually running through mobile transactions.
Yeah, almost every household in the country, at least some member of the household has access to M-Pesa. Yeah.
Exactly. So even without a bank account, you can still transact using your mobile phone. So the essence was, how can we then layer on health benefits, thereby aggregating funding to enable the moms access care. Because if you look at it, the reasons why, or the obstacles for moms to access care, number one is poverty. They don't have the funding, especially in Africa. Number two is the healthcare facilities are very far away. So it's, by the time they get to the healthcare facilities, they're late, or, a catastrophic event may have happened. Three is, the quality of care. How do you monitor the quality of care within the hospitals? And then, of course, how do you make sure that they deliver? Because it's one thing to attend the facilities when they are pregnant during the journey, or how do you ensure that they stay within that facility to deliver, and then following up with them afterwards. So on the mobile phone, as you know, the high penetration of mobile subscription. So you have a wallet which you open. First of all, you register. Funds can be transferred to you depending on whether there's a donor or the insurance onto the mobile wallet. When you get to the healthcare provider, you authorize your care. So that way we even know you're in the facility.
Mm-hmm.
So all of a sudden, the power is in the hands of the user through your mobile phone. So you authorize your care, care is provided. So for example, you have to attend 8 antenatal visits or 4 antenatal visits. You attend the first one, you authorize, we know you're there. The next time, if you don't authorize, we know when you're supposed to go, then we know something is wrong. We can follow up, we can nudge you to go back to the hospital because you have, an appointment.
Mm-hmm.
And that's the way the journey is followed. Then on the side of the providers, we also try to encourage and incentivize. So instead of paying for just one antenatal visit, we try to pay you at the end. There's some incentive, but at the end of a healthy delivery, then you get the bulk of your compensation or your payment. So that way there is kind of tracking the patient journey throughout the entire pregnancy. And not just that, you're looking at data that can help you determine and improve the quality of care along the way. Do they have high blood pressure and so on and so. So basically different dashboards for different stakeholders, the patient, the payer, as well as the provider. So we can use that to ensure there's a healthy delivery at the end. So it's
you're giving more power really to the patient now, because the patient has to sign off. The patient feels like they're part of this process, right? They have they're one of these stakeholders in a way they might not otherwise have been. Let me just bring in Nosa if I can, because what Njide has just described sounds like a fantastic one-off intervention, right? Identifying a key population, figuring out the bottlenecks and hurdles, financing, transportation, quality of care, and addressing it with a digital package. But I know one of the things you've worked on for many years now is looking at, well, how do we take us from one-off digital solutions and think about how do we build a broader kind of systemic approach to digitizing health systems? And given your perch at the Gates Foundation, this is something you're thinking about, partnering with governments. How do you think about these one-off interventions with the broader question of systemic digital change that you're trying to achieve?
Yes, well, again, just to say thank you for the opportunity to contribute to this conversation. And I'll build on Bernardo's comments and Njide's as well. There's no question that the COVID experience we've all gone through has sort of highlighted the intrinsic opportunity that is with digital. But the other reality is that if we want to do digital for it to go to scale, it is hard. It's very hard, but because it's hard is why we must pay particular attention to the factors for success. So from our perspective, most of the practices have focused on the front end, like what Njide has just described, the app and those the handheld devices, which is important. But in our view, the really important place to focus on for success, for scalability, is on the back end. And with the back end, if you focus on the back end, you have a better chance of designing out fragmentation, which is very replete in the areas that we see in the work we're doing, and also designing integration and designing interoperability. If those things are not addressed, these types of pilot initiatives will work for some time, but they will not scale and they will not go anywhere.
Yeah, I've heard, community health workers who might be working for different vertical disease areas have a different app, different phone for each one, and they're collecting data maybe on the same patient, but all of that is siloed. That's kind of issue you're trying to get at here, right?
Correct. And then the other element I just want to also point out is that, since, countries are the places where we want to scale, like in Kenya, if the country does not own the strategy, if the country does not own the process and own the governance of the data, again, I think it's a critical obstacle we have to address. And then the third, because maternal health, as we said, maternity matters. There are a few elements that I think is really useful for us to think about, for us to really build in enterprise-wide thinking and how we design for maternal health outcomes. So, for example, I was very pleased that Bernardo mentioned the idea of mother and newborn as a diet. It wasn't really mentioned explicitly, but it was sort of alluded to. That's a really important design parameter to build.
Connecting those two things together.
You can't do one, separate from the other. The second, which I want to just emphasize, is perhaps the most critical technology in maternal health outcomes is a health worker. And in several countries, and this is something that the foundation is particularly, interested in, and I think it links to Njide's point about mobile money and mobile platform. Health workers are not paid on time, and they take time away to go get salaries and co. And the net effect of that is reduced access to care for mothers. So why is it that Kenya, which was the place of birth for money, for mobile wallet, why is it that it has not scaled in other parts of Africa? What is the reason for that? It's Africa groomed, it's Africa designed, and it's scaled in Kenya. Why is it not scaling in Nigeria? Why is it not scaling elsewhere? I think that's a fundamental question. And if we address that, it has the possibility of actually helping us to address issues related to maternal health, to facilitate effective cash transfers. And I'll just make one more point. Why are we interested in cash transfers? For example, we're not saying it's a sole solution. We looked at data on demographic and health surveys across 8 countries in Africa over like 15, 20 years, asking the questions, what are the predictors of neonatal mortality and infant excess neonatal mortality in these countries? One factor that came across was the household size. If you have households of less than 4, the odds of neonatal mortality increases by a factor of 30%. It turns out that small households are generally female-headed households. Now, imagine if we had a mobile wallet that can deliver cash transfers to these types of households. It could potentially be transformational in addressing neonatal mortality and maternal mortality. So as we think about maternity health, maternity matter, an expansive view, not just in the actual care that's delivered at the facility, which is crucial, but we have to take an expansive view. And then the final one is use. And Njide has talked about that. How do we build in use as part of the framing for the use of data? So these are just elements that I think that are crucial as we think about scale and scalability.
Yeah, you put a lot on the table there, Nosa, and I want to bring you into the conversation, Natasha. And maybe the way to bring you in is that it sounds like ultimately what we need are governments that have a really evolved and thoughtful approach to digital health. And they've got a policy, it connects to everything like digital wallets and cash transfers. It connects to, certifications of public and private providers of healthcare, this kind of big picture. But the reality is not that in so many places. So how do we get from here to there? As you in your role leading global health at Accenture, you're thinking with NGOs and foundations and governments about, how they develop new approaches to solve this problem. Do we have to wait for the sort of big bang government solution? Is it about that perfect health minister, which I think maybe in some cases it has been, who has this really, evolved view of this? Or how do we actually make immediate progress given those challenges Nosa so well laid out?
Yeah, it's a great question. And to me, it boils down to how do you really create a robust digital health ecosystem? And here I think there's a lot of learnings from COVID. If we look at the countries that were most successful at leveraging digital health technologies to turn the tides of COVID, to ensure that healthcare still reached patients and populations in need beyond COVID, it were those countries that had already had a robust digital health infrastructure in place. And post-COVID is the time for us to be thinking about these things more strategically. Like all technological advancements, health impact is only going to come to those countries that make strategic investments appropriately. And here I want to point to a report that we wrote with the Broadband Commission for Sustainable Development in 2020. While it was framed as reimagining healthcare in AI and outlining an AI maturity model, the 6 areas that we talked about in that report, or the building blocks, are the same that I would point to policymakers to make critical investments around as we look to create that robust digital health ecosystem. They are things like people and workforce, data and technology, governance and regulatory measures, design and processes, partnerships and business models. While it's important to invest across the 6, perhaps I'll hone in on the first 3 because I think it really builds on a lot of the points that we heard from Bernardo and from Dr. Nosa in particular. The first being people and workforce. A country needs to have a workforce and educational system in place that really builds the cadre of individuals that are needed to develop appropriate digital health solutions. So this includes developing national curricula, building capacity within educational systems, creating national talent acquisition strategies, and most importantly, retention strategies to ensure that those critical skills stay within the health sector so that solutions can be appropriately designed. Dr. Nosa spoke a bit about the back-end infrastructure, which is what I call the data and technology elements. These are those robust technology architectures that serve as the backbone for ministries of health to really understand the data that's coming across their healthcare clinics and can help drive population health efforts. It's things like connectivity, it's things like data privacy and security measures, interoperability. And then last but not least is the governance and regulatory measures. Technology is really outpacing our regulations that we have in place, and this really has the potential to create some significant ethical quandaries when we start to think about things like individual rights, privacy, and data ownership. And so it's really important that we, to Bernardo's point, really bring in the right expertise to help us figure this out together. And think about how we develop those robust digital health strategies and regulations, put in place clear costing and implementation plans, and design regulations that put people first while balancing innovation.
There's so much there we could dig into. And I want to maybe start, Njide, with a point that Nosa brought up around the back end being more important than the front end, and how you have seen that and try to address that issue as you're rolling out mom care, as just one example. Because I'm just trying to imagine you have a specific problem you're trying to solve in the world, you see an opportunity, and yet there is this bigger picture question around fragmentation and the overall health system. How do you balance those things in your role?
So I think that interestingly, it's been, the learnings that we're taking from one country, we're refining it and, making even better in another country. So we started out in Kenya, actually a platform, but now we've brought it to Nigeria, also in partnership with MSD for Mothers. And what we're doing is supporting Lagos state government. For those who don't know, Lagos is one of the mega cities in the world with over 24 million people. And Nigeria as a whole is the country with now has the highest maternal mortality in the world. We've surpassed India. And what we're finding is, from our support to Lagos State, is we are trying to help them end to end, not just on the demand side of insurance, but also on the supply side of quality improvement, trying to help them achieve universal health coverage, from designing the benefit products all the way to training the providers on the best quality of care using a safe care methodology.
So you're saying, sorry to interrupt you, but you're saying rather than kind of launch your own program, where you're directly connecting with private sector providers, et cetera, you're going to the government and saying, how do we get the government to be in a position to supply and provide these services?
Definitely. I mean, we have run pilot projects all over and taken the lessons to the government for them to own and scale, because we found that with the private projects and the pilots, as we call it, a lot of them are learnings, they're not built to be sustainable. So what we're doing in Nigeria is finding a way to integrate those learnings and those pilots into the government's implementation of their mandatory health insurance schemes. Lagos is one of the 36 states that have passed the mandatory health insurance law, making it mandatory for every citizen to have health insurance. So we've taken the learnings from mom care in Kenya, and we're integrating it into Lagos State. So we're saying to Lagos State, this is a scheme we've tried and tested. How can we not only help you scale to UHC, but also support the pregnant moms and integrate them into the system, such that, in future we can back out and the program continues to run. So I think this is very important in terms of scalability, transparency, and also transfer of knowledge. We talked about, the regulators being behind the innovators. This is also very important. So as we're building the expertise and the capacity of government for them to be able to manage these programs from end to end. So it's a platform we're building, but with the state government in the lead, while we refine the modalities of this running in Nigeria, but in Nigeria as insurance. So it's not focused on just the mother, but insurance. But then how do we continue to track the patient, the pregnant mom, throughout the entire journey? So this is what we're learning, and this is what we're implementing. So it's very different. And in fact, towards sustainability and the adoption of digital technology, it's very important to have the state government somewhat in the lead, and then with public-private partnerships supporting their efforts to achieve the results that we desire. And we've already started replicating some of these. So for example, in Delta State, even though we haven't taken mom care there, but we are developing the primary healthcare centers along with the state government in a PPP model, such that private sector is taking over rundown PHCs, primary healthcare centers. We are giving funding to them through our medical credit fund and the Bank of Industry at very concessionary rates, so that they can refurbish and then activate those facilities. And what we're seeing is amazing. In the rural areas especially, 500% increase antenatal visits. So you ask yourself, where were the moms going? So these are the kinds of learning. So now
nowhere, I guess, right? They weren't getting antenatal care.
Yes, so we can very easily take the digital there and infuse it, because now we've seen a pattern already. So it's better and easier to track the moms, to collect data, and then improve the system. So, it's a really integrated back-end, front-end convergence using digital technology.
Yeah, that's a great example. We're starting to get questions in. Please go ahead and continue to add them in if you're following along here in the Zoom. Let me just say, some of the questions are related to COVID, the pandemic. Natasha, you brought them up, but maybe I can go to you, Nosa, in the sense that what has really shifted due to this pandemic? A lot of the things we're talking about here, we could have talked about them, I think, before COVID. So has something actually started to shift? Is this a moment of opportunity in some way? Are governments, health ministries looking at this differently? Are international institutions, are groups like the Gates Foundation looking at it differently? Has something shifted that gives us a chance to reach more moms, who need it right now?
So thank you. On the question about what has shifted, and also to be able to reach more moms, I think there's a fantastic opening for conversation around digital platforms. Again, mindful that in a number of the disadvantaged areas where we're trying to reach, there's still a digital divide. The women who we want to reach are often the ones who are less likely to have access to a phone. So there's that construct there. But I think the bigger opportunity is an awareness, a recognition on the parts of governments on us to get the community platforms right. And if we get the community platforms right, we also have the opportunity to utilize the digital plays in that platform, but within the construct of the design principles that I just talked about earlier.
Thank you for that. And maybe Natasha, I can go to you because there's a couple of questions that have come in that almost two sides of the same coin. So John Townsend asks, what progress is being made on universal electronic health records beyond vaccination records in priority areas? And then someone else has asked, well, we often see that, digital health records are considered a very important thing, but most healthcare workers dislike them intensely. Around the world, a sick baby is born and there's an urgent call to get that baby in the computer. So have we sort of gone too far, this person is asking, in trying to create the perfect system instead of focusing on low-hanging fruit to support basic clinical decision-making? What do you think about this tension? Because I noticed the tension even in the beginning of our conversation between starting with a specific project and thinking about the overall system. How do you think about it, Natasha?
Yeah, perhaps I might answer a little bit to the previous question around what's really changed before diving into that question, because there's one thing I really want people to realize, and that is COVID changed the game. We've all known for years about the potential for digital health solutions to support RMNCAH and beyond. But what changed is, for the first time, digital health solutions weren't just an enhancement, they were a necessity in the healthcare system, and they were able to provide access and delivery of critical services where we otherwise would not have been able to. And that, I think, is what's really driven this increased interest in understanding digital health and how it can be used to drive healthcare improvement, one, and two, the power of data. And we've got so many more proof points through the COVID pandemic that we can point to in order to drive continued interest and investment in this area. And to the questions that were raised around electronic health records and this tension around point solutions versus kind of creating the enabling system and having all of those different areas that I had right, it is a fair tension. And I can't say that there's a single country that's out there that has the perfect model that we can point to. There's certainly pockets of good, whether we're talking about Estonia, Rwanda, some of the known case examples that we've talked about for years. But we're going to learn as we go. I do believe that there's a possibility to start small and to scale. I do believe that solutions that are appropriately designed with scale in mind will have the right elements to become kind of broader, more integrated elements of a digital health ecosystem that includes electronic health records, that includes far beyond that. But it does require appropriate design, one, and two, the right stakeholders at the table to support that design. So I wouldn't shy away from the use case.
I mean, if you don't get this right, the danger is you end up with pilotitis, where there's lots of these one-off solutions that never scale, they never make it that far. And I think we all know examples of these, right? Where it looks great for 2 or 3 years, but then the funding dries up, especially if it's grant funding, and it doesn't go anywhere from there, right? So that's kind of what you don't want to have to wait for the perfect national digital health system. On the other hand, you don't want to design something that is never going to really survive in the long run.
Completely. I was just going to say, I don't think we think about scale and sustainability early enough. Part of that is caused by the funding mechanisms through which so many of these digital health solutions are created. One, and two, the fact that we often don't have the right experts at the table to really help organizations that are driving these solutions to think about other models beyond grant funding that can help them to get to scale and sustain.
Well, I want to bring in Julianne on exactly that point, because one thing has shifted, not necessarily due to COVID, but a number of the larger middle income and low income countries, I'm thinking about India, Nigeria, have rolled out national health insurance systems. The health insurance is becoming a more important component of this. And you talked about it yourself, Anjita, as a component of what you're doing in Lagos State. Where do health insurance systems, government supported health insurance systems, fit into the new opportunities to leverage digital to deliver health access?
So I think that's a very important question. And, you know, when I was talking last, I mentioned the fact that the policy makers are way behind the innovators. And I think that, you know, first of all, we have to look at digital ecosystem, almost like Maslow's pyramid. You know, what is at the baseline? What is at the fundamental baseline, which is electricity, the infrastructure, the broadband, before you even begin to layer on the applications, the platforms, and so on. And then when you look at the people that are making these policies, how much expertise or knowledge do they have? So if you compare it to what has happened in the banking sector, even using Nigeria as an example, the banking sector together with the regulators developed the policies that pushed for the opening of the banking sector. You know, somebody asked the question about why is mobile not scaling in Nigeria? It's not scaling because of vested interest. There is money. From the bankers, because for some reason they think that if mobile money is opened up, then, you know, they lose their profits from, you know, those opening bank accounts, but not realizing that quite a number of the people that are not in the banking system are those who are going to use mobile money. So what is key primarily is to bring the policymakers to the table, for there to be really a collaboration, because the digital ecosystem has to be built by both parties. The government, I'm not aware that, yes, they developed the strategy and the governance model, but they've never developed any solution or innovation that I'm aware of. It is the private sector that develops it, tests it, scales it. Of course, sometimes it doesn't scale because the government owns the governance structure, and sometimes some of their policies actually put roadblocks to the scale. So this is where all the parties need to be at the table at the time of not just designing the policies, but as private sector is also testing and implementing their pilots, they need to find a way to share their knowledge, their lessons learned with the policymakers, such that it can help inform them of the right policies to put in place. And I'll give you an example. I think it was about 3 years ago, Nigeria was going to roll out an NHIS system, which was supposed to be the national health insurance system, but in collaboration with the telcos. At the time, it was MTN that was approached. The premium was, the design was such that you could pay your premium through your airtime. And, you know, it was a really nice design, but the telco came back and said, well, 40% of the premium, which was 7,000, is their fee. So there is no way on earth that would have been sustainable, because, you know, you haven't even taken out the cost of, you know, capitation, fee for service, administration and all that, but yet the telco wants to own 40% of the premium that is going to be paid. So these are the kinds of examples of policies or, the private sector not seeing the big picture. So if they understand that health is so critical, something that actually would help the economy grow if we put it in perspective. Health is one of the sectors where we have not maximized the human resources, the technology that could be available, even the transactions that actually happen within the healthcare sector. It hasn't been tapped into. So for policymakers, I think that it's time for private sector and the innovators to be brought to the table. And as we talk about this, we also need to talk about the young people, because they need to be at that table too. The young people, if I finish this point, the young people in Africa, for example, dominate. In fact, Nigeria, for example, 60% as of the last count is less than 35 years. And these are the people adopting the technology. They are the innovators. They are the funds are going to their innovations. Bring them to the table so there's a dialogue in terms of policies towards sustainable health, and as well as adoption and scaling of digital technologies. I think that is so key, and that's what's lacking now.
Well, two things very quickly. One is that it's interesting that all three of you are really talking about three separate industries that are implicated here, and all three of them are highly regulated: telco, finance, and healthcare, right? And so getting three highly regulated industries that have to, in a way, work together, or the enabling environment has to be set up for them to work together, is a particular challenge. The second thing is, on your point about who needs to be at the table, we actually have a video question that was put in, and we'd like to play that now because it kind of gets to this question of who should be the players at the table. And this is from Krista Donaldson, who's the CEO of Equalize Health. And I thought we might be able to play that now if we can.
I am Krista Donaldson, CEO of Equalize Health, a not-for-profit medical technology company. At Equalize Health, like all of us here today, we believe in a world where we all have access to world-class medical treatment. We know and have seen that innovation and technology alone, though, are not enough to create impact in the lives of mothers around the world. And so we really appreciate and thank Devex, Merck for Mothers, and the Bay Area Global Health Alliance for bringing us together to talk about how we can co-create an ecosystem that leverages digital technology for maternal health. So for our panelists, you each have wonderful and amazing backgrounds and a wealth of expertise. And so I'd like to ask each of you, COVID has changed the way that organizations developing new technologies interact with their users. How do you ensure that the voice of users, mothers, healthcare workers, policymakers, they're all brought into your strategy and solution development? And how is this different than pre-COVID times? And is it easier when the technologies are digital?
Thank you for that, Krista. And I'm struck by when we started this conversation, Jide, and you were talking about how the mom care solution really gives more power and voice to the moms themselves, because now they get to indicate the quality of care they got and what kind of care they got, and they have money in that wallet. That in the end, the user here is so important. And that's one of the things that digital helps to unlock for us. So we're kind of getting short on time. We're near the end. So maybe as sort of closing thoughts from all of you is just think about this question that Krista poses us. How does the use of digital not just kind of enable the health system we currently have, but actually transform it in a new way that gives more power to the patient? And how might that be part of the answer to actually addressing this gap for moms and for kids who are dying of unnecessary causes? Maybe, Nosa, we could start with you, and we'll just kind of go down the line as we close out our session today.
No, thank you very much. So on the question of how to get different actors together, so I think one is the principle of really harnessing the power of human-centered design in this work. I think there's plenty of room to do that. About 10 plus years ago, I worked with the government of Belize in how they thought through their national health information system, which is digital, and it's largely at scale, and it's an example for the Caribbean set of countries. The doctors were involved, the pharmacists were involved, the client advocates were involved, thinking through line by line, detail by detail, the logic of it, the flow. And it's persisting and it's sustaining. And the other thing Belize did, to answer your question about can you build the entire system, or can you start? They thought about the entire system as a whole, but they brought in the different components on a modular basis so that they were all talking to each other because the foundation was well established. So I think there are possibilities and exciting ones, but we need to also make sure that we're following principles and lessons that work at a scalable level. Thank you.
Thank you, Nosa. Maybe Natasha?
Yeah, well, digital health tools have the potential to give more power to the patient. and therefore drive potential greater health equity. But that's only if they are developed and applied effectively. Otherwise, they will replicate and even amplify the inequities that we have in place. And one of the things we spoke about last week with a couple of the folks that are here on the line today was this idea of diversity in the health tech sector. This idea that our workforce that's supporting and designing and driving scale of health tech solutions don't yet reflect the population that we're working to benefit. And I really think that we need to think about that as we're trying to create the digital health workforce, because we really need those more diverse perspectives at the table to ensure that the right questions are asked.
Yeah, and it brings us from thinking about maybe the end user as a victim, a poor person, a beneficiary, to language like you might hear in Silicon Valley, a user or a customer, right? And that is a very different way of thinking about the people we're trying to serve when we design a system, and certainly gives a different level of importance to the feedback they give us about the quality of the service or the quality of the application that's being developed. And Jide, any final thoughts from you, and maybe riffing on this question from Krista about the role of the user, the voice of the people these systems actually are meant to support?
Yes, and I'll just start with the fact that we cannot achieve universal health coverage without the use of digital or leveraging digital technology. It's almost impossible. And the fact that digital transformation in health would only begin to take hold when the power moves to the patient. Like Uber, you can decide, you take your phone and call the cab to come to you. We need to begin to own our medical records, authorize our care, and so on. So the key now is, what are the different pillars that need to be built around the individual and the data, because the data flows in so many different directions. And luckily, I'm one of the Lancet Financial Times Commission on digital health and artificial intelligence that we can leverage to achieve UHC by 2030. So we're looking at some of those pillars and what needs to be put in place. And we'll publish a report, I think September this year. And it's meant for governments, regardless of what stage of achieving UHC that you are in terms of your implementation. You can take something away from that, either from the governance, from the policy, from the human rights, equity, protection, and so on. So it's very important that we do not minimize the digital technology, especially the mobile technology, because in Africa, that seems to be leapfrogging or helping leapfrog quite a lot of systems, which in the developed countries, they could actually learn a thing or two from that with that simple device, you can actually do quite a lot. So for me is, how do we make sure that the policymakers are at the table, that we are developing the right enabling environment for digital adoption by making sure that the baseline, which is the infrastructure, the digital literacy, because if you don't educate the people, then they don't even know how to begin to utilize the technology, that these all have to be put in place. So hopefully, when the report comes out, there'll be a lot of discussions around that and learnings from different countries on how we can bring this together. But there's still some ways to go, but we cannot minimize. We're going nowhere towards UHC without digital technology, and that is a fact. So
it is, right? Yeah, there's no way to bridge this without digital technology. And in a way, the pandemic has been a forcing mechanism for us, right? It's showed us that you have no choice but to move as much as you can to digital, but it's also exposed those inequities, as Nasa said, for the people who don't have access, who are at the bottom of that pyramid you described, without basic access to electricity and connectivity. I think it's been a great discussion. I've learned a lot from all of you. I know everyone virtually is applauding Natasha Sundarji, Dr. Nosa Orobatan, and Njide Ndili. Thank you so much for this discussion. And I want to welcome to the virtual stage Dr. Marianne Etiabet, who is the lead for MSD for Mothers. Marianne, welcome. I think before I ask you anything, because I want you to close this out with some closing thoughts, but maybe you can just give us your reaction to the panel and everything you just heard.
Well, I mean, wow. I'm in awe. I think that what we've heard today, from the experts on this panel has been not just a wealth of insights, but really getting a sense of the work that's happening on ground and the opportunities to leverage that action, that knowledge, that know-how, to scale. And as Ndidi said, we're not going to get to our goals of helping end, preventable maternal deaths without UHC, and we're not going to get there without leveraging the power of digital technology. Everyone has talked about how COVID has really just opened up the opportunity to think about this in new and different ways. I think it was Natasha that said, the digital infrastructure now is not a nice to have, it's not an add-on. It is an essential part of a health system and a health system infrastructure. And so if we're starting from that perspective, how do we create those multi-sectoral conversations between health, finance, banking, government? So as we're creating our new normal, private sector is investing in, I think Bernardo said, Audible, we're ordering food, we're ordering Ubers. As private sector and governments are investing in, this new normal, make sure health is at the table during those conversations. So not only that the policies that they may be shaping or crafting to support, for example, mobile payments for civil service workers, or enable, financial transactions, across phones. Make sure that health is at the table during those discussions so people understand, one, the opportunity for creating that social impact in the health sector, but also so that if there are any specific considerations or complexities that a health application creates, those are understood at the ground level and can be built up. So I think that's
because Marianne, there's no guarantee that even if technology marches forward, new startups come out and government enables them to do deliveries and transportation and energy, there's no guarantee that it actually bridges this divide for the very poorest people who don't have access today, unless we do something. And so I guess that's the question: how do we create the incentives that develop the ecosystem in the direction we want it to go?
Yeah, exactly. And that's why Merck for Mothers is having this conversation, because our concern is that every woman should have a chance for life while giving birth. And we need to think about inclusion, digital inclusion, as part of the equation. Again, back to that social impact, in the health sector. We're investing in, all of the great technologies you heard this morning, because they integrate women into the system. Health systems end, at the user. And what we've heard from our partners during COVID is those who have already invested in digital infrastructure, they were able to be more responsive to quickly changing needs of their consumers and actually respond to what was needed on ground. There's one more point I want to make, and I do think it's the kind of the elephant in the room. How do we work together to create an innovation ecosystem for digital health technologies? I think the equation is different for health than it may be for, consumer goods, or entertainment. And so we need to think about that different incentive structure. Bernardo mentioned, the goal is to make sure that data is in the hands, of the user. But most of the business models, for digital and data technology actually monetize, that's the business model, monetizing the data. And so if that incentive is not there for private sector investment in health applications for digital technology, how can we work with governments to create that enabling environment, those policies that still incentivize innovation for health application? And how can we think about innovative financing mechanisms, to actually finance that development and that application? Because it's complicated. If it was easy, it would have been done by now. And so I think, that we should not ignore that elephant on the table. The last thing I do want to say, and this relates back to, how we're working, MSD for Mothers is working with DevEx, to help close that gap. The gap is not just bringing additional financial resources to the problem, it's bringing, the innovation. And we know that, everybody believes in public-private partnerships, especially coming out of COVID. Everybody has seen how private sector has augmented government responses. I think the issue is now we need to inventory those barriers, whether they're policy barriers, process barriers, or people barriers. And that's, our partnership with you, starting to inventory this, starting to surface and create visibility for this so that we can also create accountability.
Yeah, there's this story I've told many times. 2015, at the SDGs being ratified in New York, I was moderating a session with Bill Gates, and a skeptical reporter said, hey, they're saying that to get these SDGs implemented will take trillions of dollars a year. There's no way that money is available. This is just a pipe dream, right? I mean, this isn't real. And he had a very short answer with kind of an annoyed look on his face, which was, what about innovation? And that really is the answer, I think, to everything you just brought up. We need to use this moment, use the existence of these digital technologies, these new platforms and new financing, but bring it together in a way that helps the people who need it most. And that doesn't just happen organically. It takes organizations like MSD for Mothers and the great work that you do every day, Marianne, and it takes organizations like the Bay Area Global Health Alliance. We're so proud to be partnered with both of you. Go ahead.
Can I just make one last point? Because, as we think about what the health response should be post-COVID, we should not think about that as a cost. We should think about that actually as an investment in economic recovery, doing exactly what Njidi said. If the expertise for, the technical know-how for doing this exists in those local economies. It exists in Lagos State. It exists in Nairobi. Let's pull in, that expertise in our response so that, we have it's a win-win multiplier effect. And these investments are not a cost. They're actually driving economic recovery post-COVID.
That's absolutely right. And if you're interested in these topics as you're following along today, DevEx and MSD for Mothers have been putting out a number of reports and content, articles, interviews that really dig into exactly the point Marianne is just making about the opportunity to use innovation, find new approaches, and really how this is an investment ultimately. So I want to thank everybody who's been a part of this today. I want to thank the Bay Area Global Health Alliance. I want to thank MSD for Mothers, all our great speakers and participants, and all of you who've joined us from around the world for being a part of this discussion. Thanks for the great questions. I'll mention just that there are a number of important stories, as you can see, at the intersection of human health and technology and finance. And we at DevEx are on that beat. Our journalists are covering it. We're trying to get to some of the hard questions and important answers from policymakers and leaders across the public and private sector. And we're doing that every day, but soon we're going to be doing that through a new newsletter called DevEx Checkup that you will want to check out. So stay tuned for that starting on March 11th. And thanks again to our partners and for all of you for being a part of this. Be well.